the associate partner at Ciuci, growth advisors Onome Akwara says end-to-end healthcare management is key to improving a patient's experience. Now, in a chat with CNBC Africa, she notes AGCare has developed the Clinical HEIRS framework, a 6-step model designed to address challenges and drive improvements across all aspects of healthcare delivery.
I guess it's just with everything else, how you organize it, right? If you want to figure out how to deal with any issue, is to make sense of the issue. And in healthcare specifically, I will say it's how it is managed. Now, the way we've seen it before now is when you think healthcare, you think of doctors, nurses, but there's a whole lot that goes into a patient's experience, right? So it's really now focused on how do we look and address all of those issues holistically, right? So making sense of it means how is it managed end to end. Now, from a doctor's angle is different, but the interesting thing about healthcare is really about how it is handled from a patient's perspective, because that's how success is managed. Yeah.
So more or less the perspective there. But I see that you have a healthcare management framework
yes.
In place, and I'd like to get to hear a bit more of that and more or less the key pillars driving that.
Yes. So just to give you some context, like everything else, like I said, it starts with doctors. It's always been about doctors, right? And so I work for an organization that is into operations management. Now, we get a lot of inquiries from hospitals, medical doctors who are amazing at what they do. But they're saying, hey, I'm great at this, but when it comes to administration, I give up. Come get this. And we've done that for quite a number of hospitals. So it comes down to how do you manage end to end? That is where the problem was. So that's where the problem is. If you ask me in healthcare today, we have great doctors, but how is it managed end to end? And it was in seeing that gap that we came up with what we call the Clinical HEIRS framework. And we use this for clients, and we use this across all the 4 assets that we manage, where we see over 10,000 patients average in a month, right? So Clinical HEIRS basically is an acronym, but clinical is clinical, because if you go to a hospital, you're going there because you want to get better. So there's the expectation clinical-wise in terms of your clinical outcome. You want to get better. So the clinical stands for clinical excellence. Now, it's one thing for you to feel better. I will make a patient feel better. But how do you break that down? What does feeling better mean? Does it happen when it's expected to happen? And does it happen to the degree that you want it to happen? All those things need to be measured. And then we go to the H. So breaking the hairs now, the H is for human-centered care. Again, we manage hospitals and diagnostic centers when we have a care home. And you hear things like, the doctor was in a hurry because he wanted to see someone else. So he may have seen you, he may have run some tests, you may have gotten medication, but the fact that the doctor didn't have time for you as a person is an issue, right? So we've taken time to study patient data, observe, we do a lot of ethnographic research where we follow patients from one touch point to another, and we see the human elements driven by empathy. So that H speaks to human-centered care. And then there's the E. We're catching up before we started when we talked about the place of people. So we are very big on employee development because human resource is at the center of healthcare management, right? And then there's the I, which is you cannot take away innovation from everything. Everything is about, and that's where the doctors, I dare say, need us, non-clinical folks, because we are wired a certain way, to think about the bigger picture. And we're not, for someone like me, I was in the arts. I studied theater arts. I know the opposite, but that's fine, right? So we are trained to think about things a lot more broadly. And I've also worked in the business world for quite a bit, right? So that's the difference in thinking. Now, you have some very exceptional doctors who can do this as well. I've seen a couple, but it's not a skill that is readily available. Innovation is talking about people, it's talking about how you apply data and how you apply technology as well. And then the R is the big buckets. So employees are good, but then the R is relationships. Healthcare is very capital intensive. Some of the time you can't do it alone. So relationships are extremely important. I'm talking local and international relationships. Yeah. So I'll give you an example. One of our assets, we have a telemedicine structure where you can get the second opinion without having to leave the country. It's a relationship, right, that we build on. And then the S is the icing on the cake. After you've done manage all the clinical outcomes, you've driven human-centered experiences, you've developed employees, you've innovated, you've built relationships, The icing on the cake is how do you standardize it? Make sure it happens every time and in line with the global best practice.
I think that's where there's going to be a big challenge.
Exactly. No, so we've cracked that.
Okay.
We have cracked that, right? And again, it's not, healthcare is not something you do alone. You have to know exactly what's going on. So in one of our assets, for instance, we're currently going through the ISO certification, which takes us through process design and all of that, and certain things we have to have in place minimally to be considered an ISO accredited hospital. Now that keeps us in check, in line with standardizing things, yes.
It's good that you paint the picture of the entire framework.
Yeah.
But from personal experience and also looking at the ecosystem here in Nigeria, when you look at some of the challenges that could compromise the quality of care, it can't but help to look at some underlying factors. For example, the welfare and compensation of the health workers plays a key role in how how they deliver the outcomes that were designed to get.
Yeah.
So I'd like you to speak to that and how this is captured in that framework of yours.
So that's a very interesting question because the other day someone asked me, how are you solving the Japa syndrome? Right, and this was my answer. So a very critical piece of employee development is what we call employee experience. There's some things we can't change about Nigeria, given, but there's some things that are within our control. If our doctors, nurses, medical, clinical guys leave Nigeria, the opportunities in terms of leadership and transition into healthcare management is limited. So what we've tried to do is to create what we call the AGCare Leadership Network. Now, by employee development, we give you access to, we can deploy you to other roles. You're exposed to leadership responsibilities. And then for each of these things, you get, I don't like to call them compensations because you can't put money on experience, right? But then there are benefits. We've had people we've sent out of the country, Ghana, India, on training. And then they come back and then it's meaningful work. So for us, that employee development bucket for us is very key. And I'll give an example. We manage public hospitals and private hospitals. So if you work in the public sector, there's a certain mindset. And some of my colleagues in that space have never gone private.